All right, away from the situation in Plateau State, we'll be going into health matters now. Today, we'll be delving into nutritional care for babies with cleft lip and palate. Of course, we do know that because of the condition of cleft lip and palate, suckling, particularly for children, becomes difficult. And what kind of nutrition do they also need to gain weight and also feel good like every other child, particularly because they have special needs? We do have two people who will be helping us analyze these issues and give a sense to all of that. A clinical nutritionist and dietitian from the Federal Teaching Hospital, Gombe, Karim Solomon Temitokwe, is joining us virtually, and also a consultant maxillofacial surgeon with the Federal Teaching Hospital, Gombe as well, Dr. Akintumbobo Benedict. They're both there on the virtual platform to join us. Thank you so much for your time and welcome to the program.
Good morning.
Thank you. Good morning.
Thank you. All right. So let me start with Karim here. Give us just a few backgrounding when it comes to cleft lip and palate, and then sequence it within the babies as our conversation this morning supposes.
All right, thank you. Good morning, everybody, and good morning over there in the studio. My name is Solomon, a dietitian from Federal Teaching Hospital, Gombe. When we talk about cleft lip and palate, I want to let us know that it has to do with the fact that children, infants, when they are born, there is actually a challenge with either their lips not completely fusing like every other children, or perhaps there is also a cleft in the palate. And all of these things together, if as many of us that have seen children feeding, you know that these two parts, the lips and the palate, are actually very, very essential when it comes to feeding. And without these two functioning very well, there is definitely going to be a challenge with the feeding of that child. So over and over, as we proceed, I would like us to know that children with cleft also require adequate nutrition, just like every other children. However, because of the challenges that we have already highlighted, that the fact that the lips is not able to maybe latch on baby breast of mother, or the child is the palate with some challenges, will now make the child not be able to feed adequately. However, with proper guide and proper consultation, with a good teaching education, there will be no malnutrition with any of these children. And most importantly, what we also like everybody to know is that there can be correction for even all these cases. But what matters most is that we want any child that will come for surgery or that would be corrected come with a healthy nutritional status, and with that, the surgery will be very, very successful. Thank you for now.
Okay, that's a very key, a healthy nutritional status. So that would mean that not feeding this child, that with this special need properly would result in other kind of sicknesses. Is that what it means?
What I'm trying to emphasize there is that
no, I understand. No, I understand. What I'm saying is the fact that this child has this special condition with the cleft and the lip would mean that for some mothers, mothers who do not understand how to go about this, they may not be able to feed these children well, and then it may result in other conditions, right?
Yes. You are right. So what basically we are saying here is that if mothers would not have idea, for example, if there is a cleft on the lips, and the mother does not know that, yes, there is need for a little more effort just to support this child to make sure that there is a proper latch on the breast. I'm just using an infant for an example. So before you know it, this child begins to adjust to not eating sufficiently, and I give the child 1-2 months, the child begins to come down with malnutrition. You understand? For something that perhaps the mother would have been exposed to, maybe how to make adjustment to ensure that this child feed adequately.
Okay, so let me bring in Dr. Akin Tobobo Benedict here, who is a consultant maxillofacial surgeon with the Federal Teaching Hospital, Gombe. I'm sure you've heard what Karim has said. He gave us a backgrounding on this. But let's look in specific at babies. When you think about a normal baby, the time that it takes for the child to suckle, it's always a fantastic experience for mothers when they need to bond and nurture and feed these children. But it's not always the same exercise when it comes to children with special needs such as cleft lip and palate. So tell us, I mean, what are the procedures? What goes on when you are trying to, first of all, educate a mother, and then also the importance of nutrition and the kind of nutrition for babies?
Thank you so much. Most of the family that their children are affected with cleft lip and palate are devastated because so many things will have gone wrong in the first 2 or 3 days of the birth of that child. Families will have make a lot of effort to encourage them to do some one thing or the other, to kill the child, or whether to make them feel discouraged. The mother has committed crime, maybe has slept with somebody else, the husband will bring a lot of issues. So psychological trauma, most importantly on the mother, is always too much. So luckily, if they finally got to us at a very early age of that child, maybe 2-3 days after birth or the first day of birth, then we will be able to educate them. Then let them know that this ailment is treatable. And at the same time, we show them picture of the one that we've done before. It is not their fault. Nobody has committed any crime. The child is not evil child. So we educate them on a lot of things. So as psychosocially, we stabilize the family. And then let them know what is now necessary for them to do as regarding feeding the child. As Solomon has already said, if the child is not properly fed, definitely they will come down with malnutrition. And with malnutrition, they can die. They can develop chest infection. They can have other problems. And even some of these children also, when they are born, there might be other internal congenital problem that is associated with the cleft, which might not be open to the outsiders. It is when we now see them in the hospital that we examine all these things. If there is any other internal malformation, it can also be corrected and the parents will be educated. But the most important aspect, right, the first 3 months of life of those children is feeding the child. As he has said already, it takes a lot of effort for a child with cleft to exert pressure to suck breast from the mother because the lip is not completely closed around the nipple of the mother. So sucking will become difficult for them, which might take a lot of time. So we assist them, as Solomon will be telling you later on, as to what to be done requiring feeding this child to make sure they are healthy enough for us to carry out our surgery.
Okay. Talking about this health is quite key here because everyone, you still see children who can feed properly still come down with malnutrition. So let's get back to the nutritionist in the house. Solomon, when you have a child who has cleft lip and palate, what exactly should you do, particularly when it comes to the issue of exclusive breastfeeding, which women are told to observe for their children so that they can get the initial nutrients they need for their growth, and then this child cannot suckle properly? What would you be advising a mother who is faced with such a challenge to do with this breast milk to start with? And then there are other nutritional food that she can also administer to augment the breast milk at that point.
Okay, thank you very much. Like Dr. Aki have mentioned that most of these families always have this psychological trauma where since they've not seen this kind of case before. So what we do at first is to first encourage the mother or the family to let them know that this is actually not their fault. Then having said that, there are strategies that we teach mothers to optimize breastfeeding for these children. Like we mentioned, it's just the same nutrient. They require the same nutrient just like every other children. The challenge with them is that because of the fact that they will not be able to feed very well, then they begin to go down with malnutrition. So first thing that we first teach mothers is how to breastfeed this child. We teach them different modified ways of putting baby to breast. If I don't know, for many of our mothers that are there, we understand the cross cradle with the type we used to have. So we can encourage them on, there's a particular one we talk about, modified cradle, or even the football wood. But what we want to achieve in our teaching of these mothers is, number one, to let them know that, for example, if the cleft is on a particular side of the labia, on the left or the right, we try to orientate them to keep that side that the cleft is on the upper side, so that as the child is trying to take the milk is the amount of milk that is letting out, that is going away from the mouth is reduced. So we teach them strategies of how to place the child to the breast to improve proper latching. Because in all of these things, what we are trying to encourage them is how to bring the child close to the breast milk, to the breast, unlike before. What mothers do is to take the breast to the child. If you have seen the normal practice, we do take breast to the child, and because the child can actually latch effectively, the child takes as he or she wants. But in this case, this child cannot latch properly, so we have to counsel mother on how to bring to the head of the child close so that there will be proper latching. Apart from that, we are encouraging exclusive breastfeeding. So as much as possible, if a mother gets it right, there will be no need to augment breastfeeding. If a mother gets it right, there will be no need to augment breastfeeding. There have been also histories of women, there are records of women who have effectively breastfed their children. However, most of the times, by the time these mothers will present their children to the hospital, they are already late, the children are already malnourished. And in that case, they will begin to consider alternative means so that the child will not die, because we need to save the child first. And in doing that, we may begin to consider maybe breast milk alternatives so that quickly we can help the child to recover first. And as soon as the child recovers, then we return to breastfeeding. Also, if in cases if breastfeeding, putting baby to breast would not be effective enough, we also teach mother breast milk expression. In doing that, the mother expresses into a cup observing all the necessary hygiene, express into a cup, and then continue to feed the child intermittently. So as number one, to continue to ensure that there is milk flow from the mother's breast, and also to ensure that the baby continues to enjoy the natural gifts that God has given to woman, which is the breast milk. So, but on a general note, we can teach mother how to place baby to breast to ensure adequate latching, and also we teach mother how to express breast milk. And then we also we provide alternatives if child presents with severe malnutrition, and we wouldn't want the child to die. Thank you.
All right. Okay, still staying with you, because I hear emphasis on what the mother should do, and the primary, beneficiary is the child. But also, is there consideration that mothers also have to feed longer, because babies with cleft lip and palate sometimes feed longer than the normal babies, close to 30 to 40 minutes sometimes, between a short hour of 2-hour interval. What kind of, strengthening can the mother also get in order to be able to subsist this sort of schedule? Because again, both mother and child are exerting energy in this process.
Okay, thank you very much. I would start by saying that the mother needs all the encouragement all round. The husband needs to encourage the mother, the family needs to encourage, the community needs to encourage the mother, because that is where the strength comes from, number one. Unlike like Dr. Akin has initially mentioned that some of these mothers always suffer this rejection. So if they get that encouragement, then they would also be encouraged to breastfeed accurately. Having said that, there is also need for the mother to feed very well. Like the mother's nutrition profile also needs to be improved. If a mother is already malnourished or giving some signs of malnutrition. Then it also would affect the nature of the milk that she's going to be giving to the child. So the mother also, in this case, also needs to be well fed, adequately nourished. Having said that, another thing is also positioning. You know, it's also good for mothers to also have this understanding that
I think we have that.
We're having network issues. Okay,
Enclosure.
let's see if the surgeon in the house network, maybe your network is better if you're there, so that you can talk to us about the surgery or corrective surgery that can be done for children with cleft lip and palate. And then if you can also lead us into some cases you've heard, you know, and how you were able to deal with that, particularly those who present with malnourished children.
Yes.
From what they're saying, we'll see two of them are already out.
We've lost them out.
But it will be interesting to hear from the surgeon, really, because and then I'm also interested in knowing at what age really a mother should present the child for surgery, for this corrective surgery, and then how many of the hospitals or facilities are available, and how you know, how do people know that they exist, how affordable they are, and whether there is any form of support from government, you know, or even donor or you know, donor agencies to help with this kind of situation. And because the surgeon has, of course, will have to give us a sense of how many you know, cases that they see in the hospital and how far they are able to deal with you know, some of these issues and bring back smiles to the families who may be going through. And that aspect that the nutritionist talked about, how women, you know, are really dealt with when you have a child like this, is really quite pathetic.
That's actually where I wanted to go, because you know, the well-being of a mother is as good as the well-being of a child. And if a mother is nourished and she's doing exclusive breastfeeding, then the child will be fully nourished. I wanted to find out from the nutritionist, how does a mother who has a child, a baby with a cleft lip and palate, identify malnourishment? Because again, there should be an identifiable body weight or BMI for the child to be able to say this child is within the danger zone or this child is within the ordinary basic zone for baby's body weight. One of the things I do know, I think in the last conversation we had last year with one of the organizations who I think is Share a Smile, they were here last year, and they said something about excessive sleeping for babies is an identification of malnourishment for babies who have cleft lip and palate. Another thing was for mothers to watch out for the quality of the output of the stool and the urine. So I think that those are some of the things I probably would want the nutritionist to also let us into. And again, in terms of access to socio-psychological support, whether we like it or not, these issues can be traumatic for the mother.
And stigmatization is something that you really can't do away with. In fact, I heard one complaining one day that when she had a child like that, the husband, brothers, not even the husband, or did she say the husband? I can't even remember which member of the family told her that what's the point keeping this child, that you should take the child to a motherless baby's home. Can you imagine how traumatic that can be, coming from somebody who should give you support? You know?
I think also sometimes for me is not to cast a blame game. I think here this is where information, awareness creation, sensitization is very important, because that family member is also acting out of fear and anxiety. They are thinking, oh, how much does it cost to keep such a child? Would such a child grow up to become somebody in life? Would there not be stigma in the society that would dovetail, you know, into the family of the child? How much of it can be corrected to the place where a child can be normal? And I think we have them back online. Good morning.
All right, we're happy to have you back, because there's a whole lot of issues to really sort out. Okay, so we'll come to you, a maxillofacial surgeon, consultant doctor with the Gombe Hospital, that's the Federal Teaching Hospital, Dr. Akintubobo Benedict. Thank you for coming back to us. So we were asking you earlier what happens, or the kind of cases you've heard. Can you give us a sense of how you deal with children who have been brought to you with cleft lip and palate, but they are malnourished, and how you were able to deal with such cases. And then, at what age should a parent, bring this child that has this, special need to the clinic? Dr. Benedict, this is for you.
I don't think you quite heard you.
I don't know if Karim can hear us. Solomon, can you hear us?
Please, can you unmute yourself, Dr. Benedict? I think I can see your lip moving, but I can't quite make out the words.
I can hear you. Can you hear me too?
Fantastic. Great. So we can hear you loud and clear. Did you hear the question?
That is Solomon speaking.
Oh, Solomon. Okay. The question was for the surgeon, but you can also take that up. Really, I don't know if you're in the same hospital. Yeah, I want to believe Federal Teaching Hospital, Gombe. So tell us whether there have been cases of women who came with, children who are malnourished and they needed surgery, and how you were able to deal with such cases.
Okay, thank you. We used to have a good number of them. Even up to now, we still have them coming. So because, number one, maybe peculiarity of this environment we find ourselves, and plus the fact that most of these mothers actually come from the village where they are not really exposed to education. So we often have a good number of them coming in ranges. Some of them are severely malnourished upon arrival, and some are just moderately malnourished. So, but whatever the case, between either severe or moderately malnourished, the surgeons will definitely not conduct the surgery until the child's weight is optimized to a reasonable level that the surgery can be conducted. And at that point, the nutritionist come in, that is myself, we come in, then we provide support for this mother and the children with cleft. So depending on the severity, like I mentioned, some of them we provide counseling for them, we provide relief material for them, and we ask some of them to go. They can maybe continue this rehabilitation at their respective homes. Whereas some of them, like I mentioned, those that are severely malnourished, some of them by the time they are coming already with complications. So with all of this, we will not allow them to go. We have to place them on admission, manage them inpatient until they are big enough for the surgery. So basically, we provide support to these children and to the mother, because we know that if a child is taken for surgery with malnutrition, then it's very risky, and the surgery definitely may not be successful. So we provide support to them. Thank you.
All right. So while we had that virtual break when your network went off, we were talking about how to identify malnourished children by these mothers. What is the adequate weight for the baby? Because I've often heard by some service providers, perhaps caregivers, who say that when babies sleep excessively, it also shows that they are malnourished. And what are they to look out for as mothers?
Okay, thank you very much. Okay, so as mothers, what it's expected you look out for. Number one is how often does your baby cry even for food? That is number one. Then number two, since we are looking at children, infants now who rely solely on breast milk, you may need to also consider as mothers, how often does your child wet diaper? Because if a child will not eat sufficiently, then the child will be trying to sustain itself from, he would not want to lose any of his nutrients or fluid. So the more the child takes, the more the child gives out, even in the excrete, in the urine. So other things that the mother may begin to look out for may be clinical signs of malnutrition. For example, comparing a child to another of the same age range, then you would know if you check the tissues, the body fat, if the child is gaining weight pattern, then you will know. You understand me? So, but basically, for mothers who may not have clinical knowledge, who may not have the methods of how to maybe check for signs of a. So if a child cries excessively, because he or she is not getting enough, it may be an indication that there's problem somewhere. If the child is not wetting diaper sufficiently, as maybe of children of other of his age range, then it's also an indication that the child is not getting enough. Thank you.
Okay, so let's go to Dr. Benedict. I hope you're able to rejoin us now, Dr. Benedict. Can you hear us?
Can you unmute yourself? I can see you trying to move
Check your device if it is muted. Can you hear us now, Benedict? Okay, he still can't hear us. I wonder what's happening with the network. Okay, so maybe we'll wrap up with the nutritionist in the house. You know, where the facilities are available for those mothers who are listening to you now, that they can come for such information or such, nutritional education really on how to go about their children to ensure there are no complications. Solomon, if you can hear us, you can.
I didn't get that. Sorry.
No, I'm saying where the facilities are in Nigeria, for instance, how affordable they are for these mothers to, get involved and get some of the information you're dishing out to us here, particularly those in the rural communities.
Okay, thank you very much. And at this point, I would have to recognize and appreciate a particular organization who has been doing very great to see that children with cleft are attended to, and that is a Smile Train. And I know that over the time, Smile Train has been working tirelessly to open up centers to partner with hospitals or across the nation, so that children or mothers don't need to travel far to get to a center where they will be attended to. So as I speak to you now, I am very sure that out of the whole 36 states in Nigeria, I know that more than 20, in the last time I remember, more than 20 or more than 25 already have a center where mothers can take their children with cleft to, and will get all of this support that we have analyzed. I am sure of a center in Lagos, Lut. I am sure of Ibadan, UCH.
All right, sorry, Solomon, we have to take you out from there.
And so on and so on and so on.
Absolutely. I'm sure that you saw that phone number to get your phone calls across to them just in case you want more information. We've been speaking to a clinical nutritionist, dietitian, Federal Teaching Hospital Gombe, Karim Solomon Temitakwe. Unfortunately, we couldn't get back to Dr. Akin Tubobo Benedict, but we still see him there smiling. Thank you so much for your contribution so far, consultant maxillofacial surgeon with the Federal Teaching Hospital Gombe, and well done on all the work that you do on all fours.